My name is Dr. Jason Rich, and I'm a head and neck surgeon at Washington University and Barnes-Jewish Hospital. I'll be speaking about caring for skin graft donor site and recipient sites. So oftentimes when a free flap is removed from the arm or the leg, it's important to cover that area, and we take a skin graft, usually from the thigh, and place that on the arm or the leg where the free flap was taken. This helps the arm or leg heal more quickly. The skin graft donor site is where the skin graft was taken from. The skin graft recipient site is where the skin graft is placed. It's important to take care of these sites for proper wound healing and to minimize the chance of a postoperative infection. In order to care for the skin graft donor site, or where the skin graft was taken, which is usually on the thigh, this is quite simple. While you're an inpatient, approximately day 3, usually the outer dressing is removed and the wound is left open, or there is a small thin yellow dressing left over the skin graft site. Once the outer dressing is removed, then leave the donor site open to dry. This allows a scab to form over that site, which will protect it and allow you to wear clothes over that area, and it'll be less painful. Caring for the skin graft recipient site is also very important. This is the site on the arm or the leg where the skin graft is placed, where the free flap was taken from. These skin grafts are very fragile, and so you want to treat them with care so as not to injure or rub them off as they're healing. It's important for the skin graft to stay moist. For the first week, a bolster or a wound vac will be placed on your skin graft on the arm or the leg to help it heal in. Your arm or leg will also be placed in a splint to minimize movement of your wrist or feet to allow for optimal healing. Changing a skin graft recipient site is very easy. First, you want to wash your hands with soap and water and apply clean gloves. Next, you'll want to remove the old dressing and examine the wound. When performing the dressing change, it's important to treat the skin graft with care so as not to rub it off or injure it. You'll want to take Xeroform or Vaseline gauze and then apply a copious amount of Vaseline ointment to that, and then place the gauze with the ointment over the recipient site, and then that can be wrapped with the Kerlix gauze. This is usually changed once a day, maybe twice a day if you find that the wound is too dry when you change it. Oftentimes, the skin grafts do not fully take, and so there can be prolonged dressing changes that are required. Many times when patients or family members see these wounds, it can be a little bit overwhelming because it looks so unusual. The skin graft recipient sites, either on the arm or the leg, often take a while to heal, and they go through multiple changes. This is all normal. The things that you'd want to look out for is increased pain or redness around the wound, or new drainage or a foul smell. This may indicate that an infection is present. If this is the case, you'll want to contact your surgeon immediately. The skin graft recipient sites often take quite a while to heal, and they go through progressive changes, and this is all normal, so you don't need to be alarmed.